KPIX 5 News begins with a gag order forcing pharmacists to keep quiet about cheaper alternatives to prescription drugs. Good evening. I'm Ken Bassita in for Alan.
I'm Veronica Dela Cruz. Pharmacists are fighting some obscure rules that cost you money. By law, they're not permitted to tell you ways to save. As KPIX 5's Kit Dode tells us, several California lawmakers want to change that. Kit?
Yeah, these pharmacists, they want to tell you, but they simply cannot. As a result, there's an industry out there that is reaping billions of dollars in profit. Deep inside virtually every pharmacy in America, buried deep in the fine print, is a powerful, profitable, and widely used tactic known as a gag clause. John Roth with the California Pharmacists Association explains.
We call them gag clauses, which prevents the pharmacist from disclosing to a patient when the cash price for a medicine may be less than their copay on their insurance, for example.
Take amoxicillin, one of the cheapest and most widely used antibiotics.
The cost to the pharmacy is $1.97. We would say that a typical copay for an insurance plan would be $20. So the patient's really overpaying around $18.03. And you multiply that over the 180 million lives that the big three PBMs cover, and you can see just how profitable this venture is for PBMs.
PBM is short for Pharmacy Benefit Manager. The three largest, Express Scripts, Optum Rx, and CVS Caremark, act as middlemen and negotiate prices with drug companies. Roth says since the 70s, PBMs have grown into unregulated 800-pound gorillas, pressuring pharmacies into lopsided contracts for one singular purpose.
They have these clauses for one reason: money. These profits go directly to their bottom line and are enriching their companies and harming consumers.
Mr. Wood, file item number 5, AB 315.
And so California lawmakers have taken notice. Assemblymember Jim Wood has introduced a bill that would, among other things, ban those gag clauses.
But I do believe the lack of transparency in their operations is an issue requiring greater information and accountability to purchasers and ultimately to consumers.
4 states have banned the gag clauses, and another 2, including California, are considering doing the same. The Pharmaceutical Care Management Association, which represents PBMs, declined our request for an on-camera interview but released a statement saying, "We support the patient paying the lowest price available at the pharmacy counter."
Nothing surprises me when it comes to money.
CVS customer Shirley Rowland says making patients needlessly pay more for drugs is flat out wrong.
They should pass a law making them tell you as you go in, and they can turn around and say, well, instead of buying this, you can get a cheaper version of the drug.
And so AB 315 has bipartisan support. There's a lot of optimism. If all goes as planned, then AB 315 could be on the governor's desk in about a month.
Well, Kit, what happens if the customer themselves were to ask their pharmacist for the cheaper alternative? Then what?
Yeah, you could try that. If you've got a good relationship with your pharmacist, if they know your situation, if they know that you're struggling with your budget, then they will help you out, but they do so at significant risk to themselves, because if the PBM finds out, that is a big breach of contract and they could get in a lot of hot water. So if you want to try it, good luck.
All right, Kit Dode, we appreciate that report. Thank you.